Morning, Lily, or good afternoon.
Yeah, well, morning, afternoon.
Good, nice to see you. Everybody, welcome to our sixth episode of the Mindful Medicine and Wellness MD podcast. And today we're going to talk about menopause. I'm going to try to fill in with some Ayurvedic therapies, but I haven't experienced menopause firsthand. I'm not sure I'm the right person to speak about it, but Lily's going to jump in.
Awesome. Thanks. Yeah, and I'm really curious to hear because, we're doing a lot more with hormone therapy now in the Western world of medicine. And, I'm very curious to hear and learn more about the more natural Ayurvedic ways of, treating the symptoms of menopause. Um, so I think the first thing we do need to talk about is the big elephant in the room and kind of, why if, 5 years ago, even, 3 years ago, you would go to your doctor and say, I'm feeling miserable. I'm, having hot flashes and night sweats and body aches and, all of mood changes. And, I'm going through menopause and your doctor would say, oh, yeah, it sucks. You just got to get through it. It'll be over soon, change your sheets at night, things like that. Those were like kind of, the remedies that we would do. And now all of a sudden, um, before hormones were technically going to kill you, and now everyone's, and their mother and uncles and everybody else are on hormones. So it's like, what happened? Um, so I think, starting with that, in the early 2000s, there was a study, and this is the study that, went viral and told everyone that hormones are going to kill you, with the Women's Health Initiative, the WHI. And it was a massive study. And when it went viral because it had headlines saying things, like hormones are going to cause breast cancer and heart disease and stroke and all of these things. Within days, doctors were taking all of their patients off of hormones. Um, uh, the problem is that these were like really misleading. The problem was that with the study, most of the women in it were over the ages of 60. They were at least 10 to 20 years, through menopause or even like after menopause. They were using
Which
some,
is dangerous, as I've learned. Right.
even still to this day, we really don't put women on, hormones
Yeah.
afterwards. We can go through why that is. Um, and they were also using synthetic hormones and not the bioidentical hormones that you use today. So a lot of it was like, age, the timing of starting it, all of it. And then we now learn, and they applied all of that information to everybody, the 30-year-olds, the 40-year-olds, everyone. Um, and so we now see when we look into it more that actually women who start under the age of 60 and within 10 years of actually starting menopause, so in the perimenopause, which is the years leading up to menopause, and menopause is day one when your period, when it's been 1 year from the 1 year from your last period, that's menopause. Um, you actually have benefits cardiovascularly. You reduce your mortality, you reduce your risk of dementia, you reduce your risk of colon cancer, all of these things with it. So it was a really misleading study that did, you know, take 60-year-old women plus data and, attribute it to everybody else. Um, and the reason why we don't give it to women who are 60 plus years old is because we find that, cardiovascularly, stroke wise, all of that, um, women, men too, as you age, you're at more risk of having atherosclerosis, plaque in the heart's arteries, plaque in your vessels, things like that. And when it's already there and then you add hormones to it, there is that risk of having a clot or a stroke with the hormones on board. But if you start it prior to all of that forming, when you're younger, that risk goes down and is actually even more beneficial because it helps prevent that from forming. Um, so, with all that being said, now, the American College of Gynecology, the North American Menopause Society, the Endocrine Society, everyone is endorsing hormones. There are lots of benefits to hormone therapy, and it's not just for the symptoms that we most commonly heard of night sweats and hot flashes. Um, there are things, I have patients, women patients who we talk about, there's a list that I go through of kind of their symptoms and things that they don't even realize that they're experiencing, like um, loss of feeling in your hands and feet sometimes, that's a common one in menopause. Joint aches, that's a common one. Stiffness, um, let's see, heart beating quickly or strongly, poor sleep, waking up every single morning at 4 in the morning and not being able to go back to sleep and not understanding why, increased urinary frequency, increased urinary tract infections. Obviously, more common ones like, loss of bone density and fractures. Another one I see a lot, when we check blood levels is like elevation of cholesterol. Their diet hasn't changed, nothing has changed, and cholesterol levels have gone up. Um, so, and doing all the right things and either gaining weight or not able to lose weight, like, all of these things. So, there's a lot of benefits. So when we add on hormone therapy, a lot of these things improve drastically. Um, so any questions, Larry?
So I was asking around a little bit. It's not something I don't real, I guess I do have clients that come to me and or experience these symptoms. I mentioned to you earlier. So my sister um, tried hormone replacement therapy, and I guess maybe 5 years ago. And then she developed breast cancer. She doesn't, it's so she's not real enthusiastic, but it did make her feel better.
Yeah.
My next door neighbor, whose husband is um, a physician at Lank, um, put her on hormone replacement. I guess he recommended it, and she swears by it. My sister-in-law I spoke to, who's a nurse, she said, I really wish I did it because now the absorption rate's different as I've gotten older, and I'm really worried about my bone health. So that kind of, and so I'll just, I took an endocrinology class recently, but it was taught by an MD in India and an Ayurvedic doctor. So, I mean, I'll share what they've said. Like I said, it's funny, I think, for a man to talk about this when I like to talk about things I've had firsthand experience with. Before I ever recommend an herb for somebody, I try it. Before dietary changes. Um, so this is a common thing that is how Ayurvedic physicians talk about this. Um, well, first of all, they feel we should work with natural occurring things to work your way through it with natural occurring therapies. And as we as we age, if anybody's watched some of the other podcasts, we're in the Vata when you're in, post menopause, you're in the Vata stage of life. So what you would want to do is really try to lubricate your system with Vata therapies. But anyway, here's a quote. Menopause rings the bell, welcoming and celebrating the beginning of a radiant period of wisdom and grace. This is an exciting transition. That is, if you can enter it with perspective and preparation, such as Vata gently blows a breath of insight and discovery, instead of rushing in a whirlwind of change and instability. Um, and it goes on, but basically, Ayurveda doesn't really support hormone replacement therapy. Um, and but the study I saw was involving synthetic hormones. And you've corrected me. You've said now there's more natural hormones. Um, and so instead, the traditional healing system uses a holistic approach involving herbs, diet, lifestyle adjustments to supplement the body's natural hormone balance, manage symptoms, especially during during postmenopause. So do you want me to just jump into what the
I like,
therapies we would use? I mean,
and then I'll talk about, we'll talk about estrogen and progesterone and, but yeah, very curious to hear because I still have patients who, And I'm really sorry to hear about your sister. That's,
I mean, it's 99% it's purely coincidence. But she said, we don't have any breast cancer in our family. I don't know how this,
right. But I'm
and
really,
her, and to make it more complicated, her same thing happened with her best friend.
I know. Yeah, I know. Yeah, you told me that.
And I'm not, it's not funny, and I'm not trying to make light of it, but it's happened. Um,
About
so
this.
Ayurveda views conditions like menopause not as a disease requiring replacement, but as a natural life transition that can be managed by balancing the body's three dosha. Um, and there's natural phytoestrogens, plant compounds that mimic estrogen to help the body adapt and um, and relieve the symptoms. So, and it also, so the what Ayurveda says, the individual risk profile depends heavily on several factors. And as you said, starting at 60 years or older, or more than 10 years after menopause, increases the risk of serious complications like heart disease and blood clots. And um, they do say that long-term use of heart replacement therapy is associated with a small increased risk of breast cancer, um, and uterine cancer, gallbladder disease, and dementia. So studies indicate that an increased risk of dementia if hormone replacement therapy is initiated in women over the age of 65 or more than 10 years after their menopause onset. Um, when it's initiated earlier, the effect seems to be neutral or it could be potentially helpful.
Mhm.
Um, so, I mean, it talks about the regular side effects, uh, um, breast tenderness, irregular vaginal bleeding, headaches, bloating, fluid retention, mood swings. But it does say people can, as you've said, benefit from some hormone replacement therapy. Um, so let me jump to the alternative. So a Vata diet we've spoken about is more moist things. So Vata is cold and dry, and as we're aging, we dry out more. And men and women, it's your beginning of the Vata stage of life starts when Pitta begins to slow down. The Pitta time is through your real work years.
Mhm.
Um, and then you have things like cold weather and different things that exacerbate it. So you begin to focus, and we can share what a Vata diet is with anybody. But it's the game of opposites I've spoken about. If it's cold and dry, you want to do warm and moist and nourishing moist foods. So oatmeal, which I know some people think oatmeal is really good. Some people think it's very fattening, um, warm soups, things that begin to balance, and something like shirodara, which is it's when we pour oil on your third eye. It's a little tricky sometimes getting that. It's a divine
Yeah.
therapy for men and women. I can't explain why this feels so good, but it's the most relaxing therapy if it's done properly. It's just a steady stream of warm oil that's picked for your constitution. Um, so things like Shirodara really help. And um, eating white sesame seeds for calcium is really helpful. Applying, so you can make or buy licorice ghee for vaginal dryness. Um, Shirodara, which I said, um, aloe vera is very good for this. So if you can drink, especially for night sweats and stuff. So aloe is very cooling for the body. And you could, drink a half a cup of aloe, mix it, or even a little bit less, but put in a teaspoon or two of turmeric or different things to, because aloe is a little bit rough taste-wise until you get used to it.
Oh,
Um, Shatavari, which I'd like to go into a little more detail. Vidari, an herb called cap, 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 capikichu. There's another name for this, mucuna, I think, which really helps with libido. Ch Chaiwan prash, which we've spoken about often. Um, Sandalwood oil on your forehead for night sweats. And saffron is very cooling for the body. And there's an herb called musta. It's also called nutgrass or Cyperus rotundus. It's primarily used for liver and lymph stagnation, which can support the body's menopausal detox for more appropriate pathways. They're not though um, through hot flashes and night sweats. It also is used to support the spleen, reproductive, and liver congestion of prana, according to Ayurveda and Chinese medicine. So moose is traditionally used to support healthy reproductive function um, and addressing PMS symptoms. So I don't have an experience with musta. Um, and I do have experience with shatavari. Shatavari is known as a female rejuvenator. It helps cool the body, balances hormones, and alleviates symptoms like hot flashes and vaginal dryness. I used shatavari so many times over the years for menstrual disorders. Shatavari helps with milk production. It's an amazing female tonic, but it has a lot of estrogen in it. So so that when we were trying to figure out if somebody has breast cancer in their family or is risk of breast cancer, do you recommend shatavari? And but it's also I just want to read a little more about that. It's also known as wild asparagus. It's been shown as an effective reproductive tonic for women. It boosts sex drive, men and women. Um, Also combating vaginal dryness and balancing menstrual concerns. Shatavari was shown to enhance physical stamina and endurance, as well as increase increase in the weight of fatigued adrenal glands after exercise stress. It's an adaptogen um, supporting adrenal health. And taking the stress off the adrenals allows shatavari to effectively play its role as a reproductive tonic. The herb balances the production of adrenal cortisol, making it a natural adaptogen. So, I love shatavari, and I take it as sometimes I take it as a man too, because it really lowers pitta in the summer. It just
how is it taken? Is it like a
it's a
liquid?
pill. It's just like a supplement, um, and it's kind of
How
it's
often do you take it in the day? Is
what?
it once a day?
Yeah, you could take it once a day. I mean, I probably take 1,000 milligrams a day would probably be the best. So like 1 gram a day, and it's very much like ashwagandha. And the combination of ashwagandha and shatavari are beautiful together. If and Ayurveda only wants you to take herbs like this if your constitution needs it. So we're talking generally, but um, and as I mentioned, the licorice and phytoestrogen-rich foods, soy, lentils, chickpeas, flaxseed, whole grains, um, a lot of fruits and vegetables, asparagus, sweet potatoes, which can really help increase your estrogen level. Um, and I mean, exercise, um, yoga, walking, swimming, and mindfulness practice are all
Okay.
really helpful. So, um, I mean, I think that's how I would try to help people. And There's another herb called finger leaf morning glory, which I also don't have a lot of experience with, but it's supposed to very be very helpful too. And black cohosh, which I've heard Debbie, I think, um, use for women who want to go into labor. Is that right?
So I'm not sure about that, but I do know it has helped some women with night sweats and hot flashes of menopause and perimenopause when we were not prescribing.
Mhm. And another one I found, wild yam, is widely used as a botanical dietary supplement. Um, steroidal saponins. Do you know what they are? I don't, and are considered a precursor to the hormone progesterone.
Yeah. So I've actually had patients ask me if they can take wild yam, supplements instead of progesterone, and I had to look it up because we do know that progesterone is made from wild yam, but the inactive form, they have to activate it in the lab somehow to get, the active form for progesterone. And that's what we found because I was curious to say, like I knew it was made from, wild yams, but it was the inactive form. So
Um, and then I think we should talk about osteoporosis,
yeah.
which I hear about that often from my wife, who's always worried about it. And she does chew a handful of sesame seeds every morning, because it's a good way to get calcium. And um, I think
Yeah, what do you do in the Ayurvedic world?
we try to just get as much natural calcium in as possible from soybeans, soy milk, cow's milk, cheese, carrots, coconut, calcium supplements like oyster shells, 1200 milligrams of calcium, magnesium, almond milk, but real almond milk, not the almond milk that you soak and peel the skin off, which the skin isn't great. It is very helpful. Goat's milk, soy milk, uh, I said sesame seeds, careful yoga postures. Um, I'm looking for it. I made a list of yoga poses. Um, I can't find it, but I think um, you want to do practice where you're standing on one leg,
Yeah.
and then practice. So maybe like tree pose and that type of thing, which also balances vata. But boat pose, all the poses that work your middle,
Yeah.
and um, not go crazy because your bones are fragile, but weight bearing exercise. Um,
Yoga is a great one I recommend for my patients. And I say, with weight bearing exercises, like walking is a weight bearing exercise,
Walking is the best.
exactly. And like, be like a gym bro and go like build your muscles, but moving and walking and tree pose and doing all the yoga, like that's I think great. And honestly, they're now even saying, when I practice too, I don't even recommend calcium that much anymore. It's really just vitamin D. We found that
Mhm.
vitamin D really helps to build strong bones. And if you eat, and the calcium you get in your diet is usually enough, and we don't really want to overload you because you get calcium deposits in, the
It's
artery.
not good in your heart, right?
So, eat a normal diet, don't go crazy with calcium, and then, take your vitamin D supplement. I always recommend, especially as women, is are, more prone to osteoporosis and brittle bones. So, but yeah, exactly. Weight bearing exercises, eating healthy, getting good sleep, all of that stuff is really helpful as well.
Trying
Um,
to see. I don't know what happened. I lost my list of asana poses. Sun salutations, 12 a day. Um, locust pose, lotus pose, bow pose, boat pose, spinal twist, leg lifts, chest into your knees to chest are all really good.
I feel like I did all of those this morning in my yoga.
I'm sure that's what the Ashtanga sequence, it's um,
Oh,
so I don't know. I hope that's helpful
I think,
and to give people a choice what they want to do. And
yeah,
I want to do everything Ayurvedically, but Ayurveda says if there's a better way to do it, you should do it. I just had cataract surgery. It was like the best thing I've ever done. And yeah, I can see I can drive at night again. It's so, there's a medical practice that's just fantastic. And for your eyes, Ayurveda says, and I tried it for a year to put castor oil in your eyes before you go to bed, and it
yeah.
didn't really help. So
Yeah. And I think just to be open-minded about it and not just say like, you know, being the paternalistic, typical stereotypical doctor that's like, this is what you need and do this, like having the conversation with the patient, seeing what they need. It's not, just cookie cutter medicine. It's like very individualized care. And if, someone wants to do a more natural way, we're there to work with them. It's not my body, it's, their body. So, I think being able to offer a mix of both natural Ayurvedic ways and, bioidentical hormones and, but, one, the other, or both, I think is really helpful. Um, I do think though, I do want to mention, I really do. And again, I'm not all, hormones are the best way and this like hormones are a way. Like it's not the best way, it's a way. But I will say that I feel like, between puberty and pregnancy, when your hormones go like through the roof, and, like we'd all be dead if hormones were that dangerous. All the women in the world would be dead, So,
yeah, that's an interesting way to look at it.
and when you're pregnant, your hormones are 10 times the amount of if if we're giving you like the low dose bioidentical hormones. So, I think, kind of looking at the big picture and like taking each patient individually and seeing what their symptoms are and, saying, okay, well, you're having these symptoms, this is what you need. And you're having taking it in a very individualized approach, I think is the best way to do it.
That's why I love doing these podcasts with you. No, I love that you're so open to both sides of the coin. And and I know that you not love, that you subscribe to many medical things and you went to medical school and it's
Yeah.
helpful. You're seeing it help people. And
And you look at the big picture and then not every treatment is right for every single person. So, you keep the door open and you see what works best.
Ayurveda says that we're all different and we
Exactly.
definitely have to be treated separately.
Love Ayurveda. Like, I don't know enough about it. I'm learning from you, but I feel like medicine in general, it's very population based and, what's good for the whole when Ayurveda is more, what's good for the person and looking at that person. And I feel like that's how, we as, physicians also have to look at the person and not, we have to understand the studies and what's good for the whole, but also like you're not treating the whole, you're treating the person. So, keeping that in the back of your mind too.
I'll give a little shout out to my late brother-in-law, the pharmacologist at Cornell Medical Center in New York, who we've talked about this so much, the two of us, when he was here. It's like, yeah, we help half the people half the time. That was his mantra. He said, we try. And it doesn't work for everybody.
Exactly. You got to keep that in mind. So, but yeah, like estrogen, progesterone, testosterone, they all have their place, I think, and the natural ways all have their place. And, depending on what your symptoms are, I think they can all have a role.
And, well, we're all getting older, but your body really changes and the muscle stuff really changes. And um, as much as I try and I walk and practice and do yoga and Tai Chi and walk on the Ben Franklin Bridge and um, lift light weights, you see a lot of, change that's sometimes not so satisfying.
Complaints I get that, they haven't changed their diet. They're doing more than they've ever done in terms of, like making sure to eat healthy and exercising. And, they can't lose the weight, they can't build the muscle, they can't do this. And it's like, why? Because, everything's dwindling down and you're, as you get older. And so, I think there is a time and a place for hormones. And I think they can be really beneficial. And, it's something to definitely, talk to your doc about, but that, it could be really helpful. I do know my women who who I've put on progesterone. I always say like, like it's your late brother, like a third of my patients love it, a third hate it, and a third see no difference at all. The third that love it, it's like their sleep is, they're like, I haven't slept like this in years and ages. Their sleep just gets incredible. The third that hate it tell me things like, I felt like I was pregnant again. My, emotional lability, high sensitivity to smell, bloating, like all the things. And, and
Interesting.
then the third will say like have no benefits, no negative thing, nothing at all, but we use it for the uterine protection if they still have a uterus, when I put them.
Mhm.
Um, but it's really interesting how, the same thing, similar symptoms can affect somebody so differently. So, it really is an individualized approach.
Okay, well, I hope this helps some listeners and give them a different perspective. And
Definitely you
they can
can
call us and come see us and go
reach out
more into more detail on the hormonal side or the Ayurvedic side.
for both. We can work together and do both.
Thanks so much, Lily.
Yeah, it's always great.
Okay, I'm gonna shut us off. I'll call you in a second.
Okay, sounds good.